Hey, sunshine there, my friends and colleagues, and welcome to the I Give a Damn podcast, brought to you by Fluorescene Media, the same company behind ODs on Facebook. I'm your host, Dr. Joseph Allen, and today our very special guests are Lois Schoenbrun and Donna Mikulecky from the organization Optometry Giving Sight. This episode was actually recorded just as Lois was retiring from her position and Donna was stepping in as the new executive director of this organization. And in today's episode, we discuss the global impact of vision care, as well as some leadership lessons and how optometrists can get involved and truly change access to eye and vision care on a global scale. This was really an enlightening episode for me, just learning more about the organization Optometry Giving Sight and how really it can be life-changing for so many people and just locations around the world. Please lean into this one, especially if you're somebody who looks and aspires to giving back and ways to become better connected in optometry and giving back to people of the world. Otherwise, here we go, and let's learn about the organization Optometry Giving Sight. Before we dive into the episode, I do want to give a big shout out to our sponsor, MacuHealth. If you've been following my content, then you know how deeply passionate I am about ocular health, as well as improving and protecting the eyesight of our patients in the clinic. MacuHealth is known for their triple carotenoid formula, lutein, zeaxanthin, and mesozeaxanthin. And whether you're concerned about age-related macular degeneration or just want to help your patients with the nutrients they need to stay sharp, MacuHealth has you covered. We'll talk about MacuHealth again a little bit later in the episode, but otherwise, let's get going.
Well, let me just start off by saying thank you guys both for being here. This is a really cool honor for myself just to have an opportunity to kind of pick your brains on just on Optometry Giving Sight, but also just you guys and your experiences in leadership and running such an incredible organization.
It is an amazing organization. Yeah.
Just to start off for all of our listeners and viewers, Lois, would you mind just kind of kicking off and telling us kind of who you are, your experience with optometry,
Sure.
and how you transitioned into being the executive director of Optometry Giving Sight for the last 2 years?
2.5 years. Sure, happy to. First of all, thank you for having us. Thank you for doing this podcast. It's very exciting for us. So I have been executive director of Optometry Giving Sight for about 2.5 years. I started as an association exec, was a deputy director for many years, many decades ago, and it was time for me to be a CEO. I was spending a lot of my time thinking, I would do that differently if I were in charge. And at that point, I saw the announcement to be executive, that the American Academy of Optometry was hiring an executive director. And I applied. And I think I got the first interview because my cover letter said, I grew up climbing in and out of that great big chair because my grandfather and my uncle were both optometrists. I was hired and served as their executive director for 23 years. So that's how I got into it. It's wonderful being back at an academy meeting. Great organization. I retired after 23 years in 2019 and consulted with optometry organizations and with a couple of higher ed and sports-related associations. And then 2.5 years ago, got a call and I was asked to serve as interim executive for Optometry Giving Sight. And accepted that. It was supposed to be for 3 months. And I couldn't leave. It's an important and good organization. It has been great, but I'm very happy to be turning the reins over to Donna.
So, Donna, tell us a little bit more about yourself, just so, again, our viewers and listeners know a little bit more about your background, your role in optometry, and then how this came about, this new transition.
Fantastic. Thank you. And thank you again. As Lois said, thank you for having us. We're very honored to be here today. So I entered the optometry world about 10 years ago. My background is on the business side of healthcare. So I've been in healthcare my entire career, but specifically in optometry for 10 years. Started my career with Vision Source, and I had many roles with Vision Source. And Vision Source was honored to learn about Optometry Giving Sight. They were always our charity of choice, so did a lot of things within Vision Source for Optometry Giving Sight. And then a few years ago, I was asked to actually be on the board of Optometry Giving Sight, which was fantastic. And so I've served as a board member for quite a few years. And then a little bit earlier this year, when Lois decided that she was retiring, I was able to have the conversation with them, and it just worked out perfectly that I was ready for a change, and this opportunity came up. So I know I'm following in huge, big footsteps, but super excited to be part of this organization now in a different role, at a different level, and take it to the next level.
And I know we'll definitely have questions for you about what your hopes and dreams are, but I do think we need to step back for everybody who may be chiming in and has an idea what Optometry Giving Sight is, but maybe doesn't fully understand what its mission is, its role. Would you be able to fill us in a little bit?
Sure. Excuse me. So Optometry Giving Sight was founded 20 years ago by the World Council of Optometry, Brian Holden, who many people remember, and Brian Holden Vision Institute, and the International Association for the Prevention of Blindness, IAPB. The three organizations recognized that the profession and the global community needed an organization to raise money to support the growth of the profession globally, to solve the problem of uncorrected refractive error. So there are more than 1 billion people in the world, with a B, who are blind because they need an eye exam and glasses. And there are lots of organizations that have programs to try and solve that problem. Mission trips are great. In-country programs are great. They serve important roles. We try to build sustainable solutions by building up funding, raising money to support the building of optometry schools and vision care centers, so that the people who get trained, who become optometrists, will stay in their communities to provide care in an ongoing way. So that's really what makes us different.
I see that. I'll admit, I always sort of thought that it was way more of just, oh, if we're funding mission trips, we're funding, glasses for people. It's like, no, I understand it from the bigger scale now. You guys are driving really almost the building blocks of the institution of
Yes.
eye care delivery
Yes.
on a global scale.
Yes, and specifically optometry.
Yeah.
Right? Some of our programs have the involvement of ophthalmology, but we really focus on optometry and promoting the profession globally. We have, over the last 20 years, trained, and I apologize, these are round numbers, but about 14,000 optometrists and other providers. We have financially supported the development of 8 optometry schools?
Yes,
I think it's 8. I can talk about some of those examples. It's very exciting. We've worked in more than 40 countries. And we fund about 20 to 25 programs a year. Wow. And we are tiny and scrappy. We have 7 staff.
Yeah.
Wow, yeah. To fund institutions, to change, especially in different parts of the world where who knows what legal battle or like boundaries you have to be able to overcome, the financial, the economic, there's so many things going on.
And in so many of these countries, optometry doesn't exist as a profession. So it's really, it's the building of the schools, it's funding the schools and creating the curricula, and identifying the leaders who's gonna teach and who's gonna grow the organization on the ground, who's gonna provide the evaluations, et cetera. But it's also, if this isn't a recognized profession, right, there's that piece of it as well. Okay? How do they fit in? How do they work with other professions? How do they make it work to provide care where it's so desperately needed?
there's a lot of hurdles and kind of boundaries to overcome. You said that there was at least 8 institutions.
Right.
Can you give us an example? Can you tell us kind of the story of how that even kind of...
How much time do we have?
Could you at least maybe give us an example of some kind, quickly, just at least one story of a place that you guys helped put together and you maybe are really proud of?
Okay. Start with Vietnam. Okay. Until I believe it was 2008, optometry didn't exist in Vietnam. We worked with the Brian Holden Foundation, raised the money, and I guess I should back up and say, we don't have boots on the ground. We just don't. We are the funding organization only. So BHF has boots on the ground. And we've, through BHF, funded the development, the creation of 2 optometry schools. Okay. There are now 400 students enrolled, but we have already graduated 400 optometrists who are in country serving going to schools. They have optical centers, they have clinics at the hospitals, and there's one in Hanoi and one in Ho Chi Minh City. Big success.
Can I ask, how were people getting eye care? Were they not at all?
So in many of these countries, ophthalmology existed, but there's relatively few. And we're talking about many rural communities, very poor communities. We're getting care to people. It's often through the school systems, but it's difficult. How do you reach them? One of the other examples, if there's 2 other schools I'd like to talk about, but Nicaragua. I think we started there in 2008 with just amazing support from an optometrist in Southern California, Dr. Greg Pearl, who was very active in VOSH. And we provided the funding to create the first and only optometry school in Nicaragua. They have graduated, I think the number is 476. No, it's 476 schools they work in now throughout the country. They have served 47,000 people who had no eye care. And we're talking children who cannot function in school. They can't see a blackboard, they can't read, they can't play with their friends. Their eyesight is so bad. We're talking adults, because yes, they're going into a school, but they serve the communities, right? So we're talking adults that can't support their families, seniors who are a burden to their communities, and one of the very first graduates of the school, Dr. Mercado, is now the dean of the school. So it's sustainable. Yeah. It's a sustainable solution, and the people of Nicaragua now have eye care.
And I think every optometrist, every eye care professional who obviously is listening in, I think we all understand what a major role, just something as simple as understanding glasses, refraction, how much of an impact that can make on somebody's life for certainly kids with education, but that ripple effect it creates through a community.
Yes.
So bravo to the organization for helping make that possible.
Thank you. And so many, and it's natural, but so many of us take this for granted, right? People around the world can't. They don't. So we're trying to have an impact. The last few years, federal agencies have awakened and seen and recognized the need for vision care around the world. If this problem isn't addressed, I think the estimate was that by 2030, but I could be wrong, the number's going to be up to 1.8 billion. So we're helping people, but not enough, not quickly enough.
I want to take a quick break just to remind you about today's sponsor, MacuHealth. If you are listening to this, then you probably care about eye health just as much as I do. MacuHealth offers a line of incredible supplements that's formulated around published science. MacuHealth is known for featuring the 3 most important carotenoids for your macula: lutein, zeaxanthin, and mesozeaxanthin. Whether you're managing age-related macular degeneration or simply looking to offer your patients a high-quality supplement you can trust, MacuHealth has your back. Now, back to the episode.
So with Optometry Giving Sight, again, there's a lot we can kind of talk about, understanding what you guys have done, what you guys are doing. What are ways that optometrists like myself, how can optometry, if we're like moved by this, like, hey, what can I do to help out? Like, what's something that just the average optometrist can do to kind of help the foundation?
Donate money. And there are so many ways to do that. We have a new program where we tried to pull all the various ideas and various ways that people support us into one program called Team OGS. Together, Eye Care Achieves Miracles. Okay? Team OGS. So we have doctors and practices that designate one frame or one line of frames, and for every one they sell, they donate a percentage. They may add $1 or $2 or $3 or $4 to every frame they sell. At the end of the month, send us a check. Some just give monthly. Some, Steve Rice, where's he? Missouri. A number of years ago, started a 5K, which has grown considerably. He's just amazing. It's something that people in his community look forward to, and it's a fundraiser for us.
All kinds of creative ways.
Yeah. Some passive and some not. The other thing I would say is that doctors have relationships with companies. And to the extent that they can advocate for us with those companies, that would help. We're not an organization that, it's not a direct link between supporting us and product sales. It's just not, right? We're not going to advance the sale of a particular kind of eye drops, right? Or contact lenses, okay? And yet, the need is enormous. Those will be markets eventually. The need is there, but they're not ready. Can I talk about companies, specific companies?
I think this is interesting because I've never been in a position running a company trying to fund a huge mission, and I think a lot of people probably get a lot of value just from insight from kind of your experience for both of you.
So I get it. Every company has their own priorities and their own way of supporting and giving back. CooperVision is by far our largest corporate supporter. They give us hundreds of thousands of dollars every year out of the goodness of their heart. And it's not just the company, but it's the employees. They encourage their employees to give. Groups of their employees go to visit our projects. They get excited about it. Right? They take that excitement back, and CooperVision matches their contributions. I mean, there's just so many ways that they support us, and they get it, just out of the goodness of their hearts that they know how important this is.
I've never really thought about how big of a deal that is, like how just broad of a reach, and how there, again, can be this small change in one part of the world that, sometimes I don't think about. I'm too busy with other things. Right. But that affects thousands of people. Thousands upon thousands upon thousands. And never even thought of how different markets get opened up because of that. Like, obviously not right away, but down the road. And I hope that for anybody who does donate, contributes, that they do feel good about that, because they really are opening up just opportunities for so many people.
And if I could go off on a tangent for just a second.
More than welcome.
So we have offices in the US and Canada. And the markets are very different. So there are about 5,000 practicing optometrists in Canada. and I don't remember the number in the U.S., 65,000? It used to be 40, somewhere.
Yeah, it's right, yeah, way up
It's
there.
tens of thousands. We have a much higher penetration with doctors and practices in Canada than we do in the U.S. So doctors in Canada are very involved. They give.
Why do you think that is?
I honestly am not sure, but they are serious about corporate social responsibility. They take it very seriously within their practices and within their communities, and they give. So in Canada, we're much more reliant on those doctors, and we are a huge beneficiary of the doctors and the practices. We just don't have the penetration here in the U.S. It might be that there are so many organizations in the U.S. Asking for support, but it's just very, very different. So the way that the two offices function, very different.
There's no tax write-off benefit in either direction that somehow makes it different, is there? If somebody donates,
There is a tax write-off in both.
Yeah.
But yeah, it doesn't cross
Not
country
significantly
lines.
different that would drive
that's my only thought.
Yeah,
I'm like,
yeah.
why? What would motivate? Maybe they get a tax deal. I don't know.
I think, though, to what Lois said, just from being on the board and just even being and knowing about Optometry Giving Sight for the time I've been in optometry, I do think it's a lot of competition. But what has been interesting to me as well, just even with this initial transition, that people still don't know a lot about Optometry Giving Sight. So to your point very early on, Joe, as well, was like getting this out, doing things like this, and telling our story more, I think will help. I just don't think sometimes our story has been told as much, and we sort of think it has been. I will be honest with you, I thought a lot more people knew about Optometry Giving Sight. And as I've begun to announce and tell people my new role, they're like, oh, okay, what is that organization? Would you tell me more? And I'm like, wow, I thought you actually knew. So it's been kind of eye-opening for me as well, just stepping into this role, understanding, well, we have a lot more education I think we could do.
We have a lot of work to do.
So once again, thank you for having us
Yes,
as well.
yes.
I do have this just curious question, thinking again more on the broader scale of optometry, and you guys are going into different parts of the world where optometry hasn't even been established, right? We know here in the U.S., there is, and not just in the U.S., but there's political frictions between optometry, ophthalmology. Maybe optometry doesn't integrate super well into other healthcare professions. Like they don't know what we do, what we're capable of, our education. What have you experienced in other countries of the world? How do you even begin that process of navigating that?
It's different in different places. In so many places, there is just simply not enough eye care to go around. There are not even enough ophthalmologists. And so many of our schools were created with the involvement of ophthalmology. Yeah, absolutely. I mean, the other example I could give, we have a school in Haiti. We started there about 15 years ago, maybe. Started working on it. Yeah. It's a 5-year program. We just graduated our first class. And there's about 60 students enrolled. And that's in spite of everything that's going on in Haiti. Significant political, social unrest. Students are still being educated. A lot of it is remote. We have, in the past, especially in the past year, opened up a lot of opportunities, particularly in the north of the country, for 4th and 5th years to get supervised chair time. I bring up Haiti because while we have now graduated, I think the first graduating class ultimately was 8 or 9. With the political unrest, the ophthalmologists, and there were only a handful, there were fewer than 10 ophthalmologists in the country, but they've been able to leave. So the situation for the people, the eye care, the lack of care for the people of Haiti has gotten worse. It's harder to reach the communities, and the ophthalmologists, many of them, have been able to leave the country, and they have. And so our role there is even more important.
I think for me, coming into this role, one of the things and what I loved when I came on the board was the sustainability factor. I think that is what really, in my opinion, what I recognize sets Optometry Giving Sight apart, because everything we do and everything we invest in is about sustainability. It's that old saying, we don't fish, we teach you how to fish, right? Yeah. And so I think that's what's so critical. Like Lois, like you said earlier, the mission trips and all that is a critical piece as well. And this, though, where we're building the schools, we're establishing clinics, where we're delivering that care in sustainable ways that will have a long-term impact. It's not just a one and done, and then people are like, oh, okay, that was great, but loses their glasses, or
and the prescription changes.
Right. Yeah. And it's another year till something can be done about that. These are ongoing things that are going to be there in the community for the long haul. And that's what I think really inspired me and made me even really fall in love with Optometry Giving Sight, quite frankly.
Yeah.
Because you're planting seeds, right? And I know I've gone on mission trips, and I've loved them, and I plan to do much more. But for as awesome a feeling you get, there's so much we could talk about that. But you do leave, and you're like, well, at least I did something. I did my part. But I still leave thinking, gosh, what happens now? Right? Yeah, somebody got glasses, or they got taken care of immediately at that point. But what's going to happen to them in 5 years or in 3 years?
Right.
I'm either going to have to go back, or somebody's going to.
Somebody's going to have to. Right.
But if I even try to remove myself and think, okay, how would I go about funding a whole organization to be like, I'm going to start a school, I'm going to fund that school, and then how do you keep funding that school, right? Some of these schools have been around for a few years, that's a whole other process.
It is, but again, one of our goals is sustainability. So part of the question is, how do you transition from our support to being financially stable? And that's a long process, and it differs in every country, every community. Sometimes it's, we have funded a program in Mexico for many years, for example. Highly successful, they work through the school systems, number of counties. And one of the ways that they are sustainable, they get support from other organizations as well, but they also have their own optical. And those who can afford pay for the glasses and pay for the services, and those who cannot get them free. They save money they have one style of glasses, adult size, child size, and they get to pick their color, right? But it's not like we go into an optical and get to, spend an hour trying on frames. But that sustainability piece is different everywhere. It's difficult. It really is difficult. Part of it is, we had supported development of schools and programs in, I say Tanzania. I was corrected, it's Tanzania in some parts of the world. It was a program we supported for many years. And they're clinics, and those clinics, ultimately, it was about 1.5 years ago maybe, were turned over to the local Ministry of Health. They are now integrated into the healthcare system of the country.
I'm curious, I definitely have questions about the organization, especially in your position. You've been doing this for 2.5 years. What has changed in the 2.5 years? What have you been working on? What moved you to be so involved in it? And then finally, what are your feelings with the transition with Donna picking in?
One of the hardest things for me to grasp was, besides how little I know, which is, now 2.5 years later, I know so little about international health in general and international eye care. There's so much to learn. But because we don't have boots on the ground, OGS does not have, for example, an evaluation component, right? So we fund organizations, and we look for organizations that have that expertise, so that we know that the money is going to go towards programs that work and that are, there are benchmarks, and it's being effective, and we require reporting at certain intervals, et cetera. But one of the things that we are doing that's very exciting is we are moving in the direction of funding some programs. It's not a complete change. Some programs that we fund will still be individual programs in individual countries. But we're moving in the direction of having preferred partners. So partners who have that depth of the institution, where they have the project planning and development and evaluation already built in. So for example, our key partner, the school in Haiti, the consortium, the partnership, is the University of Montreal, who is the primary implementing partner, and Brian Holden Foundation, still involved particularly with funding some of the instructors. But the University of Montreal has an international health development arm. And they have that depth, they have that expertise. So we're moving in the direction of looking for partners like that, who can look at areas of need, do the evaluation necessary, what resources will be needed, how long will it take, what do we need to put in place for this to really be effective, what are we going to run into, right? So that's very exciting. I will be following it to see how it goes. But there are organizations, I mentioned the University of Montreal, but there are others who have that institutional ability. So I think that's an exciting part of our future.
And I know, obviously, there's a kind of a changing of the guard in a way with Donna taking over. Can I ask first, just kind of, how are your feelings about this, of kind of making this transition?
Oh, I am thrilled. I think Donna's going to be amazing.
I can live up to it.
What's that?
I said, I hope I can live up to it.
Oh, you're going to be amazing. It has been an absolute joy working with Donna on the board and as our treasurer. Donna and I have come from very different pieces of the profession. And where I have a certain set of contacts and connections and relationships that I've built over the years, Donna has a different set, where I've said, we need to get a hold of so-and-so, and she's like, yeah, but do you know that person's boss? Because I do. Oh, that's even better. So I think Donna's going to be able to open doors that I just haven't been able to. So I'm very excited about that. And clearly a strong manager. I can tell you that the entire staff is very excited to have her. And the board is as well.
Well, Donna, I don't mean to put you on the spot, but clearly you've got a great endorsement. But do you mind sharing kind of your thoughts, dreams, and hopes for Optometry Giving Sight going forward?
I think a lot of what Lois said, so again, as I mentioned earlier, I've been on the board for 3 years, and it's a lot to learn. I'm sitting here listening to Lois, and I'm like going, oh my gosh, I still have so much to learn. I'm intimidated by all the things I have to learn, but equally excited. But there is a lot. I'm not going to pretend I know everything. I'm not familiar with the international world, and Lois has learned as well. I plan to learn a lot, and I'm very excited about that. I think one of the things that Lois hit on that was always a concern as mine as a board member, and by the way, I have a finance background, so I'm very analytical. KPIs and metrics are very important to me. And so when we would look at these things, I know it was questions I would ask, how do we know they're doing, we gave them money last year. Did they perform? Did they execute? Because I don't want to keep giving money to an organization if I don't know how they're doing. And if I want to go ask you for money, I want to be able to look you in the eye and say, we're supporting organizations that are sustainable. We know what they're doing. They've been successful. I'm not saying everything's going to be perfect. We all know things happen, you fund something or you work on something and it doesn't work. But overall, I want to be that person to say, yes, these are the things we funded. And look, we started funding them 3 years ago or 5 years ago or a year ago, and look at what they have done. Look at the difference they have made in whatever community they are serving. So I think the direction, the pivot Lois was talking about, we're starting to make, I think is even more critical. Not that we're going to get rid of some of the one-offs like Lois said, because I think they're very important as well, but making sure we have those metrics, we have those benchmarks, so we can go tell the stories about this is where your money went and this is the impact you made. Kind of what you said earlier, like you go on these mission trips and you feel that great thing. How do we make you feel that good about you giving some money and that making a difference? I think that's the key thing. How do you make that connection? So that's what I really want to see as we continue to move forward.
And that'll be powerful for even for myself. Like it's like I want to be able to give to Optometry Giving Sight. I want to see this change in the world, and not just I want to help a few people get glasses. It's like, no, this is changing a community.
Right.
Mm-hmm.
Have you guys had either gone yourself or have you had feedback of how the community views the School of Optometry, the access to care? Have you seen how that shifts?
I have not seen it personally, but through the reporting and the images and the follow-up to get quotes that we can use in marketing, and just a lot of the feedback that I've gotten from, for example, the CooperVision folks that have gone. I walked into one of the women's conferences, I want to say last June, small exhibit area tabletops, and I walked in, and this woman standing behind a table burst into tears. And she said, I know you from your picture, and you were on the call. She works for CooperVision, and she went on one of our trips, one of their trips to one of our programs. And the tears were rolling. She was so moved by what we were able to accomplish. And one of the children that she encountered had keratoconus. And she said, I don't care where I am and what I'm doing the rest of my life, I will make sure that child has lenses. And this is in a community where they don't have contact lenses. She said, I will make sure that this child has what they need.
I can only speak from my few experiences doing mission trips, but there was a moment, I'm helping an individual, amazing, helped hundreds of individuals. But what I really felt over like the week-long period I was there is how the entire community, even people that we weren't seeing, the entire community, they treated all of our volunteers like we were royalty.
Yes.
And they looked forward to us coming. They had entire town celebrations. It was like a parade because so I did one in Valladolid in the Yucatan Peninsula. So we were working with Mayan descendants. They had never seen eye doctors before. I saw cataracts. I saw levels of disease well beyond whatever I've seen in textbooks, let alone my just normal practice. But being able to just connect and see that relationship with communities. I also did one in Jamaica, same sort of experience. And that was the first time that I was so moved emotionally working with people that needed help. But even in a position where I saw someone with some retinal disease that I can't do anything. And I felt so helpless. I was sad because I knew there was nothing that I could do beyond just support or showing empathy.
Yeah, absolutely.
But again, the feeling of community and what I knew that just single act of us as a group being there was offering was...
People feel like they've been seen, and I don't mean that as a pun, right? They're seen. going back to your question about ophthalmology earlier, one of the things that we look for in all the projects is, do you have a referral resource? When you're doing a screening and you find something that needs an ophthalmologist. And so that's built into the programs. They have to be able to refer out. Yeah.
Well, I know you guys have been doing some amazing work. Thank you so much for just breaking down what Optometry Giving Sight really is and what you guys are trying to do, because this was honestly eye-opening to me. I've heard of Optometry Giving Sight for some time. I honestly have always sort of thought it was just, we're funding mission trips. But now really getting a better feel for the real vision, and no pun intended, but the real vision and mission of what it is and how it's changing things, optometry at really that global scale.
And again, mission trips are important, absolutely important. And some of those mission trips in terms of our programs are where groups of docs go into a community and teach at our programs. There may be a particular skill that an OD has, and they will go in and teach. So, there's a variety of types of mission trips. The other thing, one thing we didn't touch on, is getting equipment and supplies to these countries, these programs around the world. Lots of folks feel incredibly generous, and they want to donate equipment, used equipment, for example. It's appreciated, but how do you get bulbs? You got to make sure that the electrical works in that country. You got to make sure that if it's shipped to that country, that there's somebody there to pick it up and install it, and technicians to make sure it works, on an ongoing way. It's complicated, right? We're so appreciative when people say, I'm retiring, I'd love to donate, it's great. And we will put them in touch with some folks that we know who do it well, right? But it's not easy. It's another, it was one of those ahas for me, like, oh my God, another piece of this that's just difficult.
It's a lot of moving parts.
That's a good description, a lot of moving parts.
Exactly.
Yeah, and a lot of people who want to be generous.
Well, from here, is there anything else, anything that we didn't touch on that you really would love other colleagues, other optometrists, other eye care providers, that you really want them to know about Optometry Giving Sight, the mission, or anything else that we didn't touch on?
That's great. I think just a call out to visit our website to learn more. I think it's really important. Go visit our website, learn more, learn about the programs we've sponsored, and see how you can give.
Well, thank you guys both so much for spending some time with us today. From here, I just wish you guys have a great rest of your academy that we're recording here at, and perhaps we'll hear from Optometry Giving Sight again in the near future.
That sounds great. Thank you again for your time. We appreciate it.
Thank you so much for having us.
So that there was our episode for today. Thank you again for tuning in. Hope you learned a lot of new cool things from Optometry Giving Sight and how that organization is helping people around the world. I do encourage you to find ways to connect with them, chip in, volunteer, see what you can do to help them further. Otherwise, thank you so much for being here, and I hope you have a fantastic day.